Hello, I'm Morag Farker. I'm Professor of Palliative Care Research in the School of Health Sciences at UEA, and I'm going to talk to you about the symptom of breathlessness and a resource that we've developed to try and help family carers of people who experience breathlessness. So what I'm going to do is talk to you a little bit about breathlessness, talk about family carers who are in that supportive role for people with breathlessness. I'm going to tell you about our research that identified what family carers need to learn about in relation to breathlessness and also how they want to learn, and then how we went about developing a web-based resource to help them. And then I'm going to walk you through that resource. I'm going to show you the Supporting Someone with Breathlessness website. So there are lots of reasons why we can get breathless. We can get breathless simply because we get too hot, or because we do exercise, which is something that we've chosen to do and can make us out of breath. And also just when we're rushing, if we're running upstairs or something, you can just catch our breath at the top of the stairs. But there is also breathlessness that's caused by an underlying medical condition. And there are lots of different types of conditions that can cause breathlessness. So it's most common in chronic lung disease. You may have heard of chronic obstructive pulmonary disease, which is known as COPD for short. It's also sometimes called emphysema. It's also common in other chronic conditions which affect the heart or the kidneys or neurological conditions, but it's also common in some cancers. It's a symptom that's almost as common as pain, but we hear less about it, and that's partly because there are fewer ways for us to manage it as healthcare professionals, and there are fewer resources to help patients and families that are living with the symptom of breathlessness, but also because people who experience breathlessness often become quite invisible. They can be hidden because they're remaining at home and unable to get out and about. So it's a difficult symptom to manage, and it's also quite a frightening symptom and a limiting symptom. It's difficult, frightening, and limiting for patients. It's also difficult, frightening, and limiting for some healthcare professionals, but it's difficult, frightening, and limiting for family carers as well, and that's the focus of this presentation today. So people who are supporting someone with breathlessness, who are family and friends, are sometimes called informal carers, and they provide lots of different types of support. It can be very practical things such as helping with washing and shopping, providing transport, or it can be about an emotional support. And we know that anxiety, for example, plays an important role in breathlessness. But these family carers are not well supported themselves. They can sometimes feel unsure about how best to support the patient. They can lack confidence, and all of that can lead to anxiety in the carer themselves, which in turn can lead to crises. They can panic and dial 999 to get support. So we need to be much better at supporting these carers. And you can see that carers are sometimes quite hidden in the background when we think about people living with breathlessness. So because of this, we developed a research program called the Learning About Breathlessness program. And the aim was to develop a resource to help support carers who are in turn supporting patients with breathlessness. And we needed to start off by answering two questions. First of all, what do carers want to learn about to help them support someone with breathlessness? And secondly, how do they want to learn? So to do this, we gathered the views of carers themselves and also patients who are living with breathlessness due to COPD or cancer. And we chose these two conditions because they're the most common causes of breathlessness. We also spoke to lots of clinicians who support people living with breathlessness and who are experts in the symptom. So what we found was, really importantly, carers wanted and needed to learn about ways to support someone with breathlessness, but also clinicians wanted to help those carers learn. So they themselves were looking for a resource that they could point carers to help them in their role. And we identified 6 key topics that carers need to learn about. We also found there was wide variation in how carers wanted to learn. And so we had to come up with a way of meeting those varying learning preferences, and we managed to do that, and I'll show you in a moment. So the 6 key topics that carers needed to learn about were, first of all, understanding breathlessness, so what it feels like and what causes it. Secondly, anxiety, panic and breathlessness, so how to recognise anxiety and panic and what to do about it. Thirdly, it was about managing infections, so how to recognise an infection and know when to start emergency medication. Fourthly, it was about keeping active, and this wasn't just about keeping the patient active, but also the carers themselves to keep active. Fifthly, it was about living positively, and again, this was both for the patient and for the family carer. And then sixthly, what to expect in the future, so knowing what sort of things they might need to think about and plan for ahead. And then in terms of how carers wanted to learn, well, some people wanted to learn by simply looking at a leaflet, but for other carers, there was almost what they called leaflet overload. They were given lots of leaflets by healthcare professionals, and they wanted a different way of learning. Some of them wanted to learn face-to-face, either in a one-to-one with the clinician or in a group setting with other carers and patients. They liked the idea of learning from video or from a web-based platform where they could look at videos. But really importantly, they wanted to learn from clinical experts and also from peer carers, so other carers who were going through the same thing as themselves, so that they could learn from their experience and sort of learn tips and tricks that they'd found successful. They were really keen on the idea of very visual information, so pictures and film clips, as well as written material. Interestingly, we didn't expect to find this, they also wanted to learn with their patient. This wasn't true of every topic. They were less sure about learning with their patient on that last topic I told you about what to expect in the future. But they really wanted the learning material to be personalised or individualised to them. And they were happy for that resource to signpost them to other resources. So they didn't expect the resource we developed to be able to tell them absolutely everything they needed to know. So the thing that was really striking about this bit of the project was learning about the wide variety of ways in which these carers wanted to learn. So we needed to be able to accommodate that in the resource that we produced. So our solution to this was to develop a website, and a website that could be accessed in 4 ways to meet those learning needs that I just told you about. So first of all, it could be self-accessed by the carer. So a carer could find it via Google, or it could be recommended by a family member, or it could be prescribed by a healthcare professional who could suggest to the carer they might like to go and have a look at the website. It could be looked at in peer-led support groups. So they could explore the website and use it to start a discussion within the support group. In the same way, it could be looked at in clinician-led support groups that are there for people with breathlessness. Or it could be looked at in a one-to-one with a clinician. So either a clinician working with a patient and a carer together, or just with a carer. Could look at some of the material on the website and again, use that to start discussion. Really importantly, the website needed to cover those 6 topics I told you about earlier on. It needed to have a menu so that carers could choose what it was they wanted to look at, and in that way it could meet that requirement for it to be individualised or personalised. It needed to include a combination of written words and pictures. It also needed to include short film clips from experts and peer carers. It needed to include some downloadable leaflets, because if you remember, some of our carers wanted to be able to look at leaflets. And it needed to include links to other resources that were useful for carers of patients living with breathlessness. Really importantly, it needed to be badged or endorsed so that carers could feel confident that this was a viable and valid website for them to be having a look at. So having answered those 2 questions about what carers needed to learn and how they needed to learn it and come up with a solution for it, what we next needed to do was develop the prototype website, get feedback on it from carers and clinicians and patients, and then to refine it and then to try it out. So to develop the website, we worked with carers, and we worked with two types of carers on this project. People who are currently in a caring role, supporting someone with breathlessness, but also some bereaved carers. So carers who'd gone through the process of supporting someone with breathlessness, and then that patient had died, and they had an opportunity to look back and reflect on their caring role with us, to share their feelings about what it would have been useful for them to have learnt about. We also work with patients who are experiencing breathlessness, with clinical experts, and really importantly with web design experts. Now, this wasn't just people who built the website, but also with psychologists who were able to provide really useful information about the best ways to structure the information on the website so that carers could make the most of it. Also, in that process of working with these carers, patients, clinicians, and website designers, we did lots of work on developing the website name and its logo so that it was appealing to carers, and also to write the actual content with them. So we knew it needed to address these 6 topics I told you about, but we obviously had to develop the material and the content to go with that. They also work with us to make the film clips for the website in terms of filming and editing those film clips. They work with us to make and find images to use on the websites, and also to make the downloadable leaflets. So this is some of the feedback we've had from carers who've looked at the website and who helped us to develop it. So this carer said, you can only benefit from it. It's important for people who are looking after their partner or wife or an elderly family member to understand what to do and how to help as best as possible. And it's invaluable for that. And another carer said, so it does offer something which others don't, which is that it's a carer-focused website. It looks more at, I suppose, the social and relational aspects of being in this situation, which is useful. And this is a really important point. There are some fantastic websites out there giving advice for carers, of patients with breathlessness, but there is far less web-based information for family carers of patients with breathlessness. So what do the clinicians think? Well, this is a clinician who supported patients with cancer and their carers, who said it feels very professional. It makes you feel this is a safe, professional website that I can trust. So this clinician felt confident then in being able to share it with family carers and patients. And a clinician who supported patients with COPD said, I like the topics. It's not just managing the symptom, but the stress, the panic, keeping active, and living a positive life. So this is the website. It's called Supporting Someone with Breathlessness, and the domain name is supportingbreathlessness.org.uk. You can access it through the QR code on the screen. And when you do so, you'll see the homepage starts with a welcoming video that you can click on, which has a peer carer and a clinical expert in breathlessness talking about why it's important to support someone with breathlessness. And as you then scroll down that homepage, you can see there are a series of buttons and our 6 topics. So we have understanding breathlessness, stress, panic and breathlessness, keeping active, living a fulfilling life, manage infections, and what to expect in the future. And underneath each of those, you can see it says cancer or COPD. And each of those is a button that the carer can click on to find information relevant to the underlying cause of their patient's breathlessness. So really importantly, those 6 topics you should recognise as linking back to the 6 topics that carers themselves told us they needed to learn about. So it was very important to us that the topics that the website covered were relevant to these carers. So also, as well as covering what carers need to learn about, the website matches how carers wanted to learn. If you think about their different learning preferences that I told you about earlier. So it has a menu so that carers can choose what they want to look at. It has those written words and pictures. It has those short film clips with experts and peer carers. It also has downloadable leaflets and links to other resources, and it's been badged and endorsed. And importantly, we tried to design it so that it could be looked at in those 4 ways I told you about earlier, about self-access by the carer, about access through peer-led support groups, through clinician-led groups, and also through clinician one-to-ones. And you can see how this design matches those different ways that carers wanted to learn that I told you about earlier. So if we take a little bit more of a look at it, if we were, for example, to click on the COPD button under Living a Fulfilling Life, it takes us to the topic page, and you'll see that each topic has got written content and also pictures, and there are further links that you can click on to take you to other web pages on the website to give more information. For example, there's a link there, the words singing in a choir are underlined, and that's a hyperlink to take you to another page to give information about that. Inside each topic, there are also subtopics you can see on the left-hand menu. And within each of these, there are film clips of clinical experts talking about the various topics, but also from peer carers talking about their experiences in relation to being a carer of someone with breathlessness. There are also film clips of patients and carers demonstrating strategies that they use and that they find helpful in their day-to-day lives, and also discussing different topics and just the sort of strategies they've come up with, and different tips and tricks that have just helped them to live and cope with the symptom of breathlessness, but also cope with being a carer of someone with breathlessness. Also on the website, there's a tab called Useful Things, and this takes you to a page where you can download those leaflets I mentioned earlier. And these are essentially leaflet versions or printed versions of each of the 6 topics and some of the content within them. Because we know that sometimes people like written material as well as seeing material on a screen, or sometimes they need it as an alternative. And these are really handy for healthcare professionals if they want to share some of the information on the website with carers who maybe aren't able to access it themselves, or who just would prefer to look at printed material rather than on a screen. Also on this Useful Things page are links to other resources that carers and patients can find helpful. And we also have promotional materials for the website. So we produced these because carers and patients said they thought we ought to. They suggested that we had some little promotional cards that clinicians could give to carers, or that could be left in waiting rooms, perhaps in GP surgeries. And they also came up with the idea of having a sort of mock prescription pad, which the clinician could use to suggest different pages on the website that a carer might like to have a look at. So these can be downloaded from the website and clinicians can print them themselves, or we do actually have some printed ones at the moment. If you know a clinician, or if you are a clinician who's listening and you'd like some, if you contact me via email, then I can send you some while my stocks last. So we've had lots of national and international interest in the website because it is quite unique. And our website is linked from other organisations' websites. So it's linked from the British Lung Foundation, the British Heart Foundation, the Royal College of General Practitioners, and the Queen's Nursing Institute, just to give you 4 examples. And very excitingly, some of the website material has also been adapted for carers and patients living with breathlessness in Australia and New Zealand. So what we would love you to do is to explore the website yourself. You can either do this individually. If you are a member of a support group, we think you could pick a topic, explore its content together, and then have a discussion around that topic. We'd encourage you also to share it with other people. You may know people who are supporting others with breathlessness, or people who are experiencing breathlessness, or you may know some clinicians who work with patients with breathlessness. So please let them know about the website. We're keen that people find it and are able to use it. And we really welcome feedback on it. So there is a tab on the website which takes you to a feedback page where you can tell us what you think. So thank you very much for listening. Just want to thank everybody who's taken part in our research to date on this programme, so carers, patients and clinicians. Also, really importantly, the people who help us recruit participants to our projects, so CRN Eastern, healthcare professionals at recruiting sites, the British Lung Foundation Breathe Easy groups and Papworth Mesothelioma group. We would like to thank our carer advisory group. So we work with carers in an advisory group who guide us as we do our research. And really importantly, we need to thank our website stars, those carers and patients who took part with us on the project. And then I need to acknowledge our team, because the lab program team is a big team. Everybody is essential and everybody played a key role in developing this resource for carers. So I lead the program, but we also have a very important experienced carer who is our lead carer of our care advisory group, Roberta Lovick, who gives us support and advice. Sylvia Barnes, Clarissa Penfold and Gail Ewing, our study researcher team. And then these are some of the clinicians that you'll see on the website who took part in some of those film clips that I told you about. So Julie Birkin is a specialist occupational therapist. Sophie Howson is a practice nurse and Queen's nurse. Dr. Sarah Booth is an honorary consultant in palliative care. Dr. Ravi Mahadeva is a respiratory consultant, and Dr. David Gilligan, an oncologist, and they are all experts in breathlessness. And then we also had support from Dr. John Benson, who is a former GP, our health psychologist team, Ingrid Muller and Dr. Kate Greenwell from the University of Southampton, and Professor Chris Todd from the University of Manchester. And very importantly, these research programs don't happen without funding. So to thank our funders, Dimbleby Cancer Care, the NIHR Research for Patient Benefit Programme, and Applied Research Collaboration for the East of England. So thank you very much for listening. There is a variety of ways to get in touch, either by email. We have a Twitter account called the lab2_study, but we would really encourage you to have a look at the website, either by putting the link into Google, or you can use the QR code to scan. Thank you very much for listening.